My name is Michelle Perez, Erica Michelle Perez, and I'm going to be dissecting a sheep heart and explaining the external and internal anatomy of the heart. This is the heart here. For the external anatomy, this is the visceral pericardium, which is also called the epicardium. It's the serous membrane that forms the innermost layer of the pericardium, and it's the outer surface of the heart. So it's this thin layer here. To point out the apex of the heart is this region here, the bottom, and the base of the heart lies at the top part of the heart before the superior vena cava and the aorta and the pulmonary arteries start to form. So base of heart, apex of heart. The right and left atrias are found at this region. So we would split the heart into 4 chambers. This is the right atria, left atria, right ventricle, and left ventricle. The blood in the right atrium here is deoxygenated, and the blood in the left atrium will be oxygenated. The right and left ventricles are these flaps here. So this is the right auricle. I'm sorry, not ventricle. This is the right auricle, and this is the left auricle. And they are both used to collect blood. The right auricle collects blood from deoxygenated blood from the bloodstream and brings it into the right ventricle. And the left auricle collects oxygen-rich blood and sends it into the left ventricle. The right and left ventricles are basically the pumps of the heart. And this is the right ventricle, this is the left ventricle. The right ventricle is in the anterior surface of the heart, and the left ventricle is the posterior surface of the heart. The interventricular sulcus is this separation groove here that contains the major blood vessels, which are the right and left coronary arteries, and they're basically this separates the 2 ventricles on the heart. The pulmonary trunk, although difficult to see, is found in this region here. And this blood in the pulmonary trunk goes into the pulmonary vein and into the lungs. This blood is deoxygenated. Then it will go into the lungs for the gas exchange and become oxygenated. The aorta is this arch here, this vein here. Turn it around. This is the aorta, and this aorta basically the blood from here goes to the rest of the body to be distributed, and this blood is already oxygenated. The ascending aorta, although you won't be able to see much here, is in the front next to the superior vena cava in here, and goes out of the heart. The aortic arch and the 3 major vessels, this is the aortic arch here. The 3 major vessels will be found on top of the aorta, which is the brachiocephalic artery, which is next to the superior vena cava, and it's on the right side. And then the left common carotid artery, which is in the middle on the aorta, and the left subclavian artery, which is on the left side of the aorta. The superior vena cava is this artery here, and this is the top, and the inferior will be found at the bottom. The coronary sinus is the groove, or it's on the posterior side of the heart, and it's made up of 3 main vessels, and it separates the ventricles and the atriums. The blood in the 3 vessels here, they go to the right atrium, and they deliver deoxygenated blood into the right atrium. The three main vessels are the great, the middle, and the small cardiac veins. And the blood that they carry is deoxygenated. For the internal anatomy, the pectinate is on the inner wall of the right atrium, or either atrium, but it is the teeth-like muscle in the atrium. These here. And the myocardium of the right and left ventricles is here. This is the right myocardium and this is the left myocardium. It's the middle portion of the layer, and the outer one will be epi and the inner one will be endo. So this is the left myocardium. And the reason it is thicker than the right side is because the left side needs to have more force and more muscle and has more pressure because it pumps blood through the rest of the body, whereas the myocardium on the right just pumps into the lungs. The trabeculate carne is on the inner surface of the ventricles, and they're the irregular ridges, if I can open this. They're the irregular ridges of the muscle and the lower part of the ventricle. So these are little irregular muscles. The bicuspid or mitral valves are on the left side, so these are the bicuspid valves, and they separate the right atrium from the left atrium from the left ventricle. And the tricuspid valves are here, found in the right, and they separate the right atrium from the right ventricle. The chordae tendineae is at the base of these valves, these little cord-like structures, and the cusps of the valves are found right at the base of the tricuspid and bicuspid valve. The papillary muscle is found at the attached to the chordae tendineae, and the pulmonary semilunar valves are found at the base of the pulmonary trunk, right in this area, and the aortic semilunar valve is to the right of that, outside of the trunk, next to the bicuspid valve.